Hey guys, welcome to Why You Need a Health Coach web class. My name is Amy Catherine, and I am thrilled that you are joining me today. I'm very passionate about helping others achieve their health and wellness goals, which is why I became a health coach. I love the personal interaction that I get to have with each of my clients, and I'm excited to tell you more about what I do. So if you have any questions during our time together, if you're here live, post them in the chat box and I will answer them. And if you are watching the recording, just post them in the comments and I'll respond back within as quickly as I can, within a day usually. And you are more than welcome to email me as well at amy@amycatherineevans.com. And if you're watching this on a recording, that email is listed in the description. So let's just get right to it. I want you to think about your last doctor visit. How much time did your doctor spend with you? And did you discuss your health habits or nutrition or your lifestyle and activity levels in depth with him or her? Generally, the answer is no. And that's because most doctors only have a few minutes to spend with each client. And it's not that they don't want to spend more time with their patients, they simply don't have enough of it. And today's doctors are trained to focus on sickness and not implementing change. Most conventional doctors are not trained in the skill set of how to develop a long-term plan that you can implement to keep you healthy and motivated while holding you accountable along the way. They're not trained in that skill set and they don't have the time to do it. Today's doctors have less time for personal interaction and are required to have more in-depth knowledge in a very narrowly defined niche. And additionally, over the last few decades, the landscape of healthcare has changed dramatically. Chronic disease now far outweighs acute illness. And according to the CDC, as a nation, we spend 86% of our healthcare dollars on the treatment of chronic diseases. These persistent conditions, the nation's leading causes of death and disability, leave in their wake deaths that could have been prevented, lifelong disability, compromised quality of life, and burgeoning healthcare costs. And so today, I want to talk to you about how health coaches have been stepping in and taking a front seat in the treatment of chronic disease. Many chronic diseases are preventable through diet and lifestyle changes. And as a health coach, I have the time to support clients on an individual basis that their doctors and registered dietitians don't necessarily have. So let's just keep going here. So what exactly does a health coach do? What do I do? Okay, the primary goal of a health coach is to help their clients achieve their health goals. In other words, a health coach provides personalized care. Health coaches not only help clients work through lifestyle and behavior modifications, but they also mentor, inspire, guide, and motivate clients to cultivate positive health choices. And when it comes to healthy eating, we understand for the most part, we already know what is healthy and what isn't. However, there are a lot more factors to consider, which is where a health coach comes in handy. Health coaches have the luxury of time that medical doctors don't, and we have time to delve deeper into the hows and whys of your preventative care. Many doctors' offices are even starting to add health coaches to their staff, which is a huge win for patients. I can't wait. This is a trend that's growing. Also, there are grocery stores and spas that are taking on health coaches as well. Health coaches provide guidance and management in the major components of health, including their diet, physical activity, and their overall wellness. In short, health coaching is a collaborative effort between the client and the coach. They collaborate. A coach collaborates with the client. So here are some specific examples of a health coach's role. Assesses a client's current health condition and readiness to change. Conducts behavioral health screenings. Develops health goals for a client. Provides a safe, non-judgmental space to discuss the client's celebrations, concerns, and obstacles. asks powerful and illuminating questions that help guide the client to the answers which help them create lasting change. Establishes a client's plan of action. Helps the clients to develop healthy eating habits and positive physical fitness plans. Also helps the clients develop strategies and habits to help them manage stress. We help clients reach their wellness goals through complementary approaches and navigate and eliminate the roadblocks that they come across along the way. We provide sustainable accountability, and this helps keep our clients true to their goals and action plans. And we document the client's progress along the way and often work closely with the client's doctors and others on their health professional team, providing the client's progress reports to their doctors. So health coaching utilizes evidence-based clinical interventions, which incorporate a three-pronged approach. 1, the best available research evidence bearing on whether a treatment works and why it works. 2, expertise to identify a client's individual health state and their risks. 3, the client preferences and values. So the methods of health coaching involve motivational interviewing to facilitate behavior change, the trans-theoretical model of change, goal setting, and active listening. So what does this mean? Let's take a look at each of these in more detail quickly. Motivational interviewing is a client-centered counseling approach to elicit behavior change in clients by helping them resolve any ambivalent feelings and insecurities which are holding them back from their goals and find the internal motivation that they need to reach their goals. Motivational interviewing is a practical, empathetic, and a short-term process, and it takes into consideration how difficult making life changes is. Behavior change. Behavior change refers to the efforts used to address and change personal habits to prevent the disease and achieve wellness. Trans-theoretical model of change. Well, this is a way to assess your readiness to act on a new behavior. And by that assessment, we can provide adequate strategies that help guide you to lasting change. Goal setting is a personal development tool used by health coaches to create an action plan, which is designed specifically to motivate and guide that individual toward their specific goal. Active listening. This is a huge part of health coaching. It's a communication technique used during our sessions where we fully concentrate on what you as an individual are communicating to establish an appropriate plan of action best for you. All right, let's talk about credentialing. Many health coaches earn specialized certifications, and there are many different organizations available to choose from for their education. Requirements for various certification agencies differ, with some requiring licensed health professionals or bachelor's degrees, while some support individuals coming into this field without any medical background. Certification is not always required. However, it does increase credibility, right? A strong background in fitness and healthcare is a must for health coaches. And you'll per state, the requirements regarding certification and licensing, it varies. So for me, I received my health coaching certification through the Institute for Integrative Nutrition in New York City. I'm also a certified personal trainer and a 200-hour yoga teacher in training. I got my bachelor's degree in biochemistry at West Virginia University, and I'm currently a doctoral student of integrative and functional nutrition at Saybrook University in Pasadena, California. So nutrition is a very important piece to our overall well-being, and the field of nutrition is always changing. The research, we're always learning new information. So it's always been a passion of mine to learn and stay current on the current research and learn about the important role nutrition plays in our bodily functions. And Then I'm very passionate about providing free resources and educational opportunities, which is why I'm here with you today. Since COVID-19, I've dedicated myself to providing these resources in these weekly webinars. And I have a YouTube channel where you can access these webinars, and ongoing learning opportunities will be available as well. So many coaches follow a health coaching model. And the first step involves establishing a relationship. Building trust through rapport is essential for a successful client-coach relationship. Trust is essential. The second step is motivational interviewing, and that's through building strong communication strategies. And this step actually helps the clients become aware of their personal challenges and limitations. And the goal is to focus on the present and explore the client's core values and goals. And it is most important for the clients at this point to express a desire for change rather than being told change is necessary. The most lasting change results when the client is ready for that change. The third step is creating a wellness vision. So this includes your physical, emotional, social, spiritual, and financial realms of your life. And a wellness vision is used to help clients reach optimal well-being by connecting you to your own truth and wisdom that is already within. And lastly is goal setting. So the coach helps the client by acting as a guide throughout the goal setting process. And this is a collaborative step between the client and coach, because setting appropriate goals that are achievable is crucial when helping clients achieve their wellness and success. It's important to keep in mind a health coach may not be a licensed dietitian. Many states require a separate license for prescribing specific diet plans. However, a health coach can help you understand the fundamentals of nutrition. Health coaches are also not medical advisors who treat medical conditions or disease. We can, however, and often do, work alongside your medical team to help you create the lasting changes necessary. What happens often is you might receive a list of foods that you need to avoid or include, or exercise to start an exercise regimen. But as mentioned before, the registered dietitians and the doctors are not trained in helping you actually implement these changes in a way that's sustainable. And this requires more hand-holding, cheerleading, and accountability. So the following list, it describes the role of a health coach that helps facilitate the client in reaching their wellness plan. So a health coach offers support for the client in self-management. And this can include providing educational resources and helping the clients problem solve. A health coach can help clients become well-versed in the healthcare system and the medical resources available to them. A health coach is excellent for providing emotional support. And a health coach can be useful for building a relationship with medical providers by helping clients keep their health histories so that they can provide updates to their medical doctors. And also, we help provide ongoing support throughout the client's efforts. And addressing any kind of roadblocks along the way and helping the client overcome those. So health coaches are increasingly in demand, and we help fill in the gaps of traditional medicine. The future of healthcare is reshaping, and the focus is moving from treatment to prevention. While conventional medicine specializes in acute illnesses, chronic disease is now noted as being an epidemic today. And because acute and chronic diseases act differently in the body, traditional medicine simply cannot and does not have the necessary approaches in place for treating chronic disease. In fact, you've probably most likely heard the care called chronic disease management. However, like I mentioned before, many chronic diseases are preventable through diet and lifestyle changes. And that's where health coaches have taken a front seat in the healthcare system today. The holistic care that they provide is truly the future, and treating the whole person and not just the symptoms. So here are a few approaches that we'll dive into more deeply as we move on through that health coaches utilize and that conventional care simply doesn't have the foundation for. And that's our focus on holistic care, making a personal connection, SMART goals, retraining the brain, self-reliance, and lifestyle habits. Let's just dive into those each a little bit more. Health coaches have the unique ability to focus on a holistic approach. So what does this mean? Holistic health is defined as an integrated approach to healthcare that treats the whole person, not simply symptoms and disease. The concept is based on the idea that the human being is multidimensional. Therefore, health and wellness approaches need to consider the physical, emotional, social, and spiritual needs of the person to achieve optimal health. And health coaches do just that. We work one-on-one with our clients to focus on their emotional, physical, behavioral, nutritional, and lifestyle factors that are needed to enhance overall health and well-being, because they all tie in together to your overall well-being. Another aspect often lacking in traditional healthcare settings is an established bond between the patient and the doctor. And health coaches work hard to provide genuine and meaningful interactions by building respect and trust with our clients. We take the time to get to know our clients in order to help them set up attainable goals. By understanding the psychological, behavioral, and emotional needs of our clients, we can provide a truly personalized, client-centered experience. By understanding lifestyle factors, for example, someone being too busy to cook a healthy meal every day, well, a health coach can provide alternatives and tips for healthy eating while taking into account a client's busy lifestyle. The goal is a positive change. And of course, this cannot happen without understanding what a client is and is not capable of, and maintaining that relationship and that personal connection as the process evolves and the client becomes more capable along the way. By understanding fitness style, personal interests, past successes and failures, health and fitness attitudes and beliefs, a health coach can work to establish attainable goals. Goals will be assessed as an ongoing process for both short and long-term objectives. A health coach will help you take the vague ideas and aspirations and transform them into a reality by setting SMART goals with you. And if you haven't heard of SMART, just a little review. SMART stands for S, specific, M, measurable, A, attainable, R, relevant, and T, time-bound. Setting SMART goals provides structure and trackability to help clients be successful. They provide clear milestones and an estimation of the attainability of each goal. So your health coach will work with you to answer the following types of questions in setting your SMART goals. What exactly do I want to achieve? Where, how, when, with whom? What are the conditions? What are the limitations? Why exactly do I want to reach this goal? What are the possible alternative ways of achieving the same goal? And of course, retraining the brain. So, as I mentioned, health coaches offer this support in so many different ways. And one specific technique is to help clients identify their negative thinking patterns about themselves and their health to change how they look and feel about themselves by identifying negative, irrational, and erroneous beliefs. Health coaches help their clients establish a positive internal dialogue, that positive self-talk. Retraining your brain to think more positively takes work, but it is very effective. By shifting your focus on the positives rather than the negatives, your health outcomes change as well. For example, instead of saying, I hate to exercise, you remind yourself, I feel great following a workout. And over time, your brain begins to automatically shift to a more positive way of thinking without much effort. There's plenty of science to back up the power of positive thinking. And if you haven't seriously taken the time to identify your negative self-talk and limiting beliefs, and begin to put serious effort into retraining your brain, it is definitely time to experience the power of positive thinking, and a health coach can help you along the way. Oftentimes, we are not even aware of the negative internal dialogue. It's so automatic for us, and a health coach can help bring that to light and make you more conscious of those limiting beliefs and that negative self-talk, and point out when you're going there, and help you reframe that internal dialogue so that you have more positive self-talk. It's important to understand we all have the power to be responsible for our own health. Traditional doctors are there to help treat your symptoms, but they can't prevent illness the way you can for yourself. Not even I can do this for you, or any health coach. And this is empowering. And as a health coach, I want to help you succeed, and will be there every step of the way. But I can't do the work for you. But what I can do is give you the tools and the help that you need to foster an environment for success. Being self-reliant increases your internal motivation and helps you to adopt healthy habits. And developing healthy habits and being self-sufficient helps you maintain independence later on in life as well. Health coaches understand the need for people to feel empowered and can help provide the means for encouraging the very valuable confidence and growth that everyone can benefit from. Healthy lifestyle habits can last a lifetime. And the better care you provide for yourself, the better you can care for others as well. Health coaches enable individuals to see the value in reaching their health-related goals, as well as building a meaningful connection between their lifestyle choices to experience a truly fulfilling life. Behaviors such as the food you eat and the amount of sleep you get each night and how physically active you are significantly impact your health. Each of these behaviors can either positively or negatively affect your overall health in significant ways. And ultimately, a health coach will enable you to take ownership of your experience and create positive, lasting lifestyle changes. When conventional medicine began, again, we mentioned this before, the aim was treating acute infectious diseases such as tuberculosis, typhoid, and pneumonia. Today, however, chronic disease attributes 7 out of 10 deaths in the U.S. Acute conditions are sudden and often severe. Examples include anything from a broken bone to an asthma attack. However, chronic conditions, on the other hand, develop and they worsen over an extended period of time. They are slow killers often, and sometimes silent as they are working underneath the surface. Heart disease tops the list, followed by cancer, chronic lower respiratory diseases, stroke, and diabetes. And we'll talk more about each one. Many contributing factors to chronic diseases are preventable. For example, lifestyle influences such as diet and exercise. However, we already know this. Diet and exercise helps prevent chronic disease. It's common knowledge these days. But if implementing these changes were easy, we'd already be doing it, right? Fortunately, health coaches are trained to help guide you along all of the facets involved in making lifelong lifestyle changes, and we are equipped with the health and wellness knowledge to support you along the way as well. The Centers for Disease Control and Prevention reports that over 1/3 of American adults are obese. 1/3. And 17% of children and adolescents are obese. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer, some of the leading causes of preventable death. Some studies have shown that health coaching to be effective in helping individuals lose and maintain weight, and in turn, lowering their disease risk. Many even report increased confidence in their weight loss when they're working with a health coach. Health coaches don't focus exclusively on things like calorie reduction or increasing physical activity. Rather, we teach the fundamentals of behavioral modification and aid our clients in overcoming the mental barriers that keep them from achieving their weight loss goals. The key to success is attributed to a health coach's ability to effectively encourage clients to make those permanent and positive changes in their lives by committing to living a healthier lifestyle today, tomorrow, and for the rest of their lives. The CDC reports about 610,000 people die of heart disease in the U.S. every year, which accounts for 1 in every 4 deaths, 25%. Furthermore, heart disease is the leading cause of death for both men and women. Risk factors for heart disease include high blood pressure, high cholesterol, and smoking. And the sad truth is nearly 50% of Americans have at least one of these risk factors. And the other lifestyle factors that put people at a higher risk for heart disease are being overweight, being obese, having a poor diet, being physically inactive, and excessive alcohol use. And all of these can be improved and managed with the help of a health coach. Studies have shown patients in a coaching program achieve a significantly greater change in their total cholesterol, as well as improvements in secondary outcomes such as weight loss, increased exercise, improved quality of life, less anxiety, and improvement in their overall health and mood. Cancer is the number 2 cause of death in developed countries and number 1 in underdeveloped countries. Scientific experts worldwide agree that at least half of all cancers and cancer-related deaths are preventable, whereas only 5 to 10% of cancer cases actually have a genetic link. So cleaning up your diet, exercising, and regularly detoxifying are extremely important for achieving optimal health and reducing your risk of cancer. Surprisingly, sleep deprivation has also been linked to having a higher risk of cancer. Yep, sleep is important, guys. I say this all the time to my clients and my friends and family. And when it comes to cancer, also what you eat matters. The most cancer-causing foods include refined sugar and flour, soda, microwave popcorn, food in cans produced with BPA, grilled or processed meat, and hydrogenated oils. The food choices that you make every day can raise or lower your cancer risk. And a health coach can help you remove known offenders from your diet. The CDC reports chronic lower respiratory disease, also known as chronic obstructive pulmonary disease, as the 3rd leading cause of death in the United States. While exposure to air pollutants in the home and workplace, genetic factors, and respiratory infections do play a role, tobacco use is the key factor in the development and progression of this disease. A number of studies have shown positive results with interventions by health coaching as a tobacco cessation program. One study concluded a 32% quit rate among participants who received regular coaching. And so a health coach can actually help the smokers who are ready to quit, support smokers throughout their quitting process, and help smokers stay smoke-free, keep them from going back to an old habit. Stroke is the 4th leading cause of death in the U.S. and the leading cause of serious long-term disability in the United States. Nearly a quarter of strokes occur in people under the age of 65. Studies report many stroke survivors admit to feeling overwhelmed by the treatments recommended by their healthcare providers. And evidence shows that participation in programs like health coaching teach self-management skills and education, and this improves the quality of life and the self-efficacy after stroke, which again is how a health coach can help significantly in stroke recovery. Health coaching helps to enable individuals to improve and manage their stroke recovery with access to individual-centered and practical support when needed. Stroke prevention can also be achieved with the help of a health coach. The primary risk factor for stroke is hypertension or high blood pressure, which can be managed through diet and exercise. So a health coach would recommend recipes low in salt, as well as boosting your fruit and veggie intake. And other changes a health coach may recommend may include limiting your alcohol intake, regular physical activity, managing your stress, maintaining a healthy weight, and quitting smoking. Several studies have shown health coaching to be effective in improving various aspects of type 2 diabetes. More specifically, it has been shown to have a positive effect on patients' knowledge, skill, self-efficacy, and behavior change regarding type 2 diabetes improvement. The CDC reports that type 2 diabetes accounts for 90 to 95% of all diagnosed cases of diabetes in adults. And type 2 diabetes is largely preventable. 1 out of 3 adults has prediabetes. However, 9 out of 10 of these people don't even know that they're pre-diabetic. Wow. Significant risk factors include your age, excess weight, particularly around the waist, family history, physical inactivity, and poor diet. Maintaining a healthy weight and regular physical activity are known to reduce the risk of type 2 diabetes significantly. The Diabetes Prevention Program found that weight loss and increased physical activity reduced the chance of prediabetes turning into type 2 diabetes by 58%. And I want to thank all of you for taking the time to join me today. Thank you for taking time out of your day today to be with me. Being a health coach is something I'm extremely passionate about. I love watching others while they achieve their goals and supporting them along the way. So if you have any further questions, please post them or email me at amy@amycatherineevans.com. If you're here live, I'll take those live. And I just want everyone to know that I'm here to support everyone. And I do look forward to hearing from each of you. So please reach out to me and schedule some time. I currently have availability for free health coaching sessions. Your first consultation is an exploratory session where we can actually discuss some of your health concerns and goals and how you might benefit from working with a health coach. So don't forget to sign up for my upcoming webinars I have, and you can find them here at this link I'm going to put in the chat box. And again, that link is in the description of the video if you are watching the recording. So guys, again, once more, thank you very much for your time, and I look forward to being here again with you soon.